Neil, now I've muted you. You can't say anything. Are you recording? Give us a thumbs up. I can't see that you are. Oh yeah, I've got it. I've got it. So, Stephanie, how you doing? Right. Okay. So, hey, Wednesday night training, and I'll tell you what, we're really fortunate because we've got a fantastic agenda lined up. So first off, we've got Stephanie Fritz, the Essentials Midwife, and Stephanie's going to be covering the safety and the use of essential oils in pregnancy, as well as protocols and things that you would use them for, you know, pregnancy, birth, babies. And then after that, we've got Tina Parker coming on, and Tina's going to be covering her own protocol with the doTerra essential oils and the supplements for managing fibromyalgia. So first off, just a quick introduction to Stephanie. So Stephanie's has her own very successful midwifery practice in Arizona, and had that since the year 2000. Wow, the millennium. I mean, that it seemed like yesterday. Where does time go? She began utilizing essential oils with her clients and their babies as a natural health solution back in 2008. And since then, she's watched her clients' health and comfort increase dramatically. She loves to share how these powerful plant extracts can empower everybody. So whether or not you're a midwife, a doula, a mum, or just somebody that wants to take control of their health in a natural way. So Stephanie is a virtual midwife to many of those that are outside of a local kind of geographical reach where she can get to. She helps pregnant mums, doulas, midwives, and people just like us to find clarity, confidence, and the tools that they need to trust birth and have the experience, you know, that they desire. As a midwife and educator, Stephanie's website gets about 30,000 visits a month, and she reaches over 105,000 people on the social media posts each week. She's a speaker and author of 2 books, including the bestseller Essential Oils for Pregnancy, Birth and Babies, and also has several ebooks as well. She travels all over teaching about the use of essential oils and the safety throughout sort of pregnancy and with babies. So Stephanie's been married to her best friend and the love of her life, Paul, for 36 years. They've got 4 beautiful granddaughters and have 5 adorable grandchildren. They recently moved from their home, where they were for 24 years in southern Arizona, to a beautiful cabin in the mountains in Utah. That sounds fantastic, doesn't it? So she's a midwife, an author, a public speaker, a therapeutic gemstone practitioner. And if that isn't impressive enough, then Stephanie's also a doTerra diamond leader and aroma touch technique trainer. Yeah, so and in her spare time, if there is any. So anyway, listen, without further ado, let's give us a big cheer really for Stephanie Fritz, the Essentials Midwife. So Stephanie, are you there? Silent cheer.
I am here, Dave. Thank you so much. You can all hear me. Sound check is good.
Yeah, coming through lovely.
Awesome, awesome. All the way over the pond. That's impressive, the technology that we have, right?
Never catch on with it.
Okay, thank you, Dave, for that great introduction. I love that. And, you know, yeah, I have to admit, I wrote it myself, but, you know, thank you for that. And but I do want to give a shout out to you and your leaders, because honestly, I don't do this very often. I just don't have time. And so when Dave reached out to me, I, you know, kind of, you know, had to think about it for a minute or two, but just felt impressed that this was something that I should do. And so, but this is not the norm. So kudos to your leaders for reaching out and making this happen, because honestly, it's a rare. So I used to speak all over, and now my time just doesn't allow me to do that so much. Obviously, you can see I don't have a lot of spare time. So anyway, hopefully today I will be able to give you a little bit of glimpse into the safety of using these essential oils for pregnancy, birth, and babies, because that is my passion. I started doing this in the early 80s. And then when doTerra came along, honestly, I enrolled before they even had labels on the bottles. So it's been, from the very, very beginning. And I'm going to share a little bit more about my beginning as we get started. And I'm also going to talk really fast. So you guys probably think I have a funny accent. I hope that you can understand me. But I'm going to talk fast because I have a lot of information that I want to convey to you in a very short amount of time. So write fast. I'm going to give you things that you'll definitely want to write about. And honestly, I'm actually super grateful for this opportunity because I get asked so many questions. You really just can't even imagine how many questions I get asked every single day. And I try and answer all of them. And so my intention is to empower you so that you can have this information. And when you're presented with questions, you now can answer them. You'll have those answers to answer because obviously we have, a big variety of friends here. None of you guys are going to be having babies, and some of you are older and you're not going to be having babies, but everybody knows someone who is pregnant or in those childbearing years. And so this is to help you help those. So also I wanted to let you know this is my book, Essential Oils for Pregnancy, Birth, and Babies. It's the second edition. If you have the first, the difference is the first is very doTerra-ish. So it has all the doTerra blends in it. The second one, I completely scrubbed of doTerra. So it just has the generic blends of doTerra. So instead of Aroma Touch, you'll see Massage Blend. Instead of Balance, you'll see Grounding Blend. So that's the difference. It does have about 50 more pages, so a little bit more information. This second one was, I published in 2015. So as you know, there's still a lot of oils, a lot of updates that are not in here. And in all honesty, I probably am not ever going to update it. I shouldn't say ever or never because, things happen. A miracle could happen. But I really feel like this is the foundation. And then if you want to know more updated oils and protocols, because there's a lot, then you can follow me on social media, The Essential Midwife, or go to my website, and my blog has tons of information, theessentialmidwife.com. So, and that's where also you can find my book and purchase it. I also am coming out with a new ebook that you'll be able to purchase that just has all of my protocols in it. So that will be a fantastic resource. This has all of the information behind it, all the whys, and the protocol book will just have this is how. So just to give you a little sneak preview of that. Everything that I'm going to tell you comes from my own experience. So I don't get my information from the internet, or things like that. It really comes from my own personal experience. And in using these oils and just the impressions, and I've had lots of, angelic help, if you will, along the way as I have used these in my practice. So the first thing that I want to talk about is essential oils during pregnancy, and I want to help you understand categories and systems in our bodies. So we have categories of essential oils. So we might have a whole of pain essential oils in that category. We might have a whole category of digestive oils, and there might be 10 or 15 in each of those categories. We might have a respiratory category. And so like for instance, and sleep. So certainly there are lots of oils to help us sleep. If lavender doesn't work for you, well, then I'm sure there's another one. Just like when we go to the doc, or when we used to go to the doctor, and he would, give you medication, you come home and that doesn't work, then you go back and, okay, this isn't working, and he gives you something else. So same with essential oils. You try an oil that doesn't work, then, well, obviously that wasn't the right oil for you. Let's try this one. And so that's a really great approach for those of you that are sharing these oils with others, because, there's always another oil to try. And so in the beginning, we had, we have like our digestive oils. So say we have peppermint and cardamom and ginger and digestan. We have those oils to help with nausea. And now later on, copaiba is brought to us. So now we can add that to the mix. So you have lots of different opportunities to use lots of different oils, and everybody is different. So you're not going to get the same results one person to the next. So just switch it up and use a different oil in that category. Also, you want to know dosage and the specific number of drops. And so I'm going to tell you those just because you want to know, but really, if I could convey the most important thing to you, is just use common sense. And there's really not a specific science behind that. Just use common sense. Generally, a good rule of thumb is 3 to 5 drops for adults, 2 to 3 drops for children, and 1 drop for babies. So that will just give you, as we go on, just kind of keep that in mind. Also, general dilution guides. You're going to see from one end of the spectrum to the other different dilution guide ratios. So the way I look at it, and I got these, this is what Dr. Hill taught at convention. Mild oils, you would dilute like a 1-to-1 ratio. Sensitive oils, you would dilute like a 1-to-2, and more caustic oils, a 1-to-3. Now, certainly you can dilute more than that. Absolutely. Your 1-to-2 ratios might include oils like bergamot, black pepper, ginger, lemongrass, lime, peppermint, wintergreen, those type of oils. Your oils that are more caustic, more hot, that you might dilute more would be like cassia, cinnamon, clove, oregano, thyme. Those kind of oils you're going to want to dilute definitely a little bit more. And, so again, just keep that in mind, that there are lots of different dilution guides out there, and you're just going to follow what you feel, what you feel good with. So 2 questions that I get asked all the time. First of all, are essential oils safe for pregnancy, birth, and babies? And how about the Lifelong Vitality Trio? Can I use that in pregnancy? Can I use that as my prenatal? So we're going to address both of those today. First of all, essential oils are completely safe. That the information that you might read, or you're going to hear a lot of information and read in a lot of different books how they're not safe and oils to stay away from and all of that. So I'm going to tell you that that information was written for all oil users in mind. doTerra is different. doTerra takes their oils to a whole new level of potency and purity. And so I know that I can trust doTerra's essential oils. That being said, there are still a couple that I say to avoid, and that is clary sage and jasmine. Now, both of those are still totally safe in pregnancy, but they may cause any contractions that you have be increased. And so I don't know your history as far as like if you've had a history of miscarriage or things like that. So I just say avoid them altogether in your full term. Does that make sense? So those oils in a blend are going to be okay, because now they react totally different in a blend. And I'll talk about that a little more in a bit, but just keep that in mind, that clary sage and jasmine, you're going to save until your full term. And then once you're in labor, or maybe even starting to stimulate labor, then those would be totally fine to use. And then peppermint, I have you avoid after birth if you're breastfeeding, because it may decrease your milk supply. It doesn't always, but it may. And same with clary sage. Clary sage may strengthen contractions, and it may not. You could be 41 weeks and ready to have, you just can't wait to have this baby, and I can use a whole bottle of clary sage and it may not do a dang thing. So again, everybody is different, and you have to be in alignment with that. And so even peppermint, so like Slim and Sassy that has peppermint in it, or past tense that has peppermint in it, may be totally fine for you in the blend. So just keep that in mind. If you do have a decrease in breast milk, then Copaiba is going to come to your rescue and help counteract that right away. When you're pregnant, did you know you have a superpower? And that is growing humans. And so I like, hands down, that's the best superpower you could ever have, is growing a human. But that takes energy. And so you oftentimes moms feel just totally exhausted in pregnancy. Oils to help with that are going to be your citrus oils, are going to help boost those energy levels, and peppermint. One of my favorites is to do a drop of wild orange and a drop of peppermint in my hand and just rub my palms together and inhale. It smells heavenly when you do that. Motivate. That's what we did in the beginning. Now we have Motivate, and that is a great oil to help give you some energy also. So don't be, think about what we had in the beginning and now the newer oils that we have, and we just add those to that list of those categories. These oils are also great to diffuse. So any of your citrus oils like wild orange and peppermint would be great to diffuse. Frankincense, again, when in doubt, always use frankincense. It's like the best. Around 28 weeks, did you know that your fluid levels double in pregnancy? So that's about the time when you would notice some swelling. So your shoes may be fitting tighter, your rings may be fitting a little bit tight. And so rightly so, your body has a lot more to compensate for, a lot more to circulate. And so circulate is a key word. You're going to think about how you can help your body circulate a little bit more. Your citrus oils are going to help that. Your liver and kidneys love when you do citrus oils. They're seriously doing a happy dance when you put some citrus oils in your water. Whether you're pregnant or not, it doesn't matter. Those oils are super supportive for your liver and kidneys. So Aroma Touch is the oil of massage, the massage blend. And the number one oil in that is cypress. So cypress is great for circulation. So my go-to for those cankles, as moms often call them, is grapefruit and either Aroma Touch and cypress. It smells amazing. Just massage that with some fractionated coconut oil into your ankles and feet and up your calves, and it's awesome. So in your water, green mandarin is amazing. My favorite is green mandarin and grapefruit together. So make sure that you're getting enough water. I recommend 3 to 4 quarts of water a day when you're pregnant, because again, that just is helping your liver and kidney flush things through and work. And again, when you put your citrus oils in there, your organs are just doing that little happy dance. So after you've come home from a long day and you want a bath, and also swimming is going to help that edema also, any sort of immersion in water. A bath is going to help with that also. But remember, oil and water don't mix. So you run your bath and you put a few drops of oil on it, and now you just have these droplets on the top of the water. That doesn't do a lot of good. And so I always recommend to emulsify that oil before you put it in the water. So what I mean by that is you're going to take like a handful or a quarter or half a cup of Epsom salts or sea salts, or, you know, any sort of salt. It really doesn't matter. Put your oils in there and, you know, your drops of oils, and then swish that in your warm water, in your warm bath water. So that will help. So now that oil is all mixed in the bath and not just floating on top. If you don't have salt, liquid soap works well for that also. Or this is going to sound weird, but even whole milk or cream, because those oils now combined with the fats in the whole milk or cream. And so it doesn't take much. Again, just a couple of tablespoons, put your oil in there, swish that in the bath, and you're good to go. So baths are great for that swelling. Also just nice and relaxing for a stressful day when you're pregnant or when you're not. Essential oils for the skin. So usually around, oh wait, I have a recipe to give you for that edema. So when you have that those cankles, as we so lovingly like to call them, here's a blend that will help support that. So 5 drops of Aroma Touch, 5 drops of cypress, 5 copaiba, 5 grapefruit, 3 lavender, and 2 lemongrass. And you're going to put that in a 10 ml roller bottle, fill the top with fractionated coconut oil, and apply that on the ankles and massage that in. Or you could even put it in a 15 ml bottle, fill the top with fractionated coconut oil, and then just drop your drops on your ankle and massage. So a great blend for that. A blend for nausea, because in the beginning, you know, that's our first sign of pregnancy, is that nausea. And so a good blend for that is 5 drops of peppermint, 5 drops of cardamom, 5 lavender, and 5 copaiba. And then put that again in your 10 ml bottle, fill it to the top with fractionated coconut oil, and that's going to be your nausea tamer blend. So you're going to apply that on the palms of your hands, rub it behind your ears, the back of your neck. Your pulse points are a really great place to put the oils, and also on your forearm right here, because this is very thin skin, and so it will get into your body super quick. So those are a couple of blends that we've already talked about. Now for your skin, oils that are really great for skin. Of course, we have our Floral Touch rollers that are fantastic. They're my new favorite. But prior to that, I would use geranium, helichrysum, myrrh, melaleuca, sandalwood, rose, frankincense. All of those are great oils to support the skin. Now, a shortcut, I'm going to give you a blend for stretch marks, because around 28 weeks, your second trimester, going into your third trimester, now that tummy is stretching, the skin is stretching, and it's going to be a little itchy and kind of uncomfortable. And so I have a Tummy Magic blend that I'm going to give you, which is 5 drops of copaiba, 5 yarrow palm, 4 sandalwood, 4 cedarwood, 4 frankincense, and 3 myrrh. So there's a shortcut to that, and that is take a bottle of Immortelle, split it into 2, fill it with fractionated coconut oil, and there you have it. Those are those, great oils that also help with that. So again, those are oils that you would rub all over your tummy to help with that stretching skin. So let's move on into oils for labor. So 2 oils that if I don't have time, someone asks me, what are your favorite 2 oils to take for labor and birth? My number 1, 2 are Balance and Wild Orange, because Wild Orange puts you in that happy place. It gives you energy. It's who doesn't love Wild Orange? And Balance helps keep you focused in the present moment. So it's going to be, those are 2 great to diffuse. They're great to mix together and do a foot massage. Just a great pair to use in oils. Balance was actually the very first oil I used when I very first got my doTerra oils, and I was being very conservative. I was at a birth. I had a mom that had some previous abuse, and I wanted to make sure that I was 100% present for her. So I put Balance on me. I just rubbed it in my palms, put it behind my ears, behind my neck, and just made sure that I had that balance on for me personally. When I get to the birth and we're, definitely into labor and we're sitting outside, and I was rubbing her back and just kind of swaying with her. And every time she would sway towards me, she would kind of nestle her nose in my neck. And I thought, oh, she's smelling that Balance. That's cool. I'm just going to hold that space for her. That's awesome. And now we go in the house. Things are moving along. It's time. She was doing a water birth, so she wanted to get in the tub. She got in the tub, and a little bit later kind of had a little panic attack. And she said, Stephanie, I need you near me. There's something about you. There's a smell. There's something. I need you near me. And I knew exactly what it was. So I had my assistant go out to my car and grab my oils. Again, very first birth I ever used these oils with. So I was being very conservative. I was just using it for me. So I get the oil in the house. I didn't even put it on her. I just unscrewed the lid and held the bottle open. And she was in the tub, and she would sway back and forth. And every time she would sway to that oil, she would take a whiff of it. So that's my testimony to you. Really, all you have to do is take the lid off. You don't even have to put it anywhere. You just take the lid off, and it's magical. Well, everything calmed down. We had a perfect, beautiful birth. 3 days later, I was over doing checkups, and she said that oil was a lifesaver for her, because prior to that, she was having flashbacks, and she couldn't be in a space that she felt safe to give birth. And so that oil brought her right back to this present moment. And I loved that, because oftentimes, whether you have, any sort of abuse or not, that doesn't matter. You could be thinking about some story that somebody told you that, put fear in you, or even the future. Can I do this? Am I going to be a good enough mom? All of the things. And really, the best thing to do is focus right here and now on this contraction. And that's what I help my moms to do, is to just breathe through this one contraction, and they finish that one, and they don't have to do that one again. You're done with that one. And we're still in that present moment. So Balance and Wild Orange are by far there's lots of great oils to use. There's like, seriously, black pepper is amazing for back labor. Copaiba, anything pain related, Copaiba is great for. Contraction stall, clary sage is going to be my go-to. So you need some energy, some frankincense, and peppermint and wild orange. Rub that in your hands. Smell that. That's going to be fantastic. Motivate is another really great one. Like, you get to the pushing stage and I just can't go any further. And I pull out that Motivate and give her a little motivation talk, and with the smell of the Motivate, and all of a sudden they can move mountains. So there's lots of oils to use that are fantastic. Wild orange and balance are at the top of my list in as a general rule. Then there are others that I would use for more specific things like black pepper for back labor. So perineal support. Now baby is getting ready to come, and helichrysum is going to be my favorite oil of choice for that. So helichrysum is like the arnica of essential oils. Arnica is a homeopathic. It helps with, so helichrysum helps with bruising. It helps with stress and trauma. It helps with bleeding, all of those things. And so I want that perineum area to be, to be supported with helichrysum. And if it gets on baby's head, well, that's okay too, because as baby comes down through the birth canal, their bones in their head have to kind of mold together and cross over. That can't be very comfortable. And so helichrysum helps support baby's head also. Fantastic for just to help with that area so that mom can stretch easier and she doesn't tear, and also supports baby as well. So I love that. Peppermint and myrrh are oils that I would use to help turn a baby. So for instance, I would put peppermint on like from hip to hip and go around the top of the belly like this. And I would put myrrh down on the low abdomen where I want the head to be. And so that's my protocol for helping when a baby is in the not the optimal position. I'm going to help support by helping that baby turn. Babies don't like that cold, and peppermint is very cooling. So when I put that peppermint around the top of the belly, then that's going to encourage baby to move. So again, that's a great protocol to remember just for breech. Or if you have a baby that's posterior, where the it's the sunny side up, then I would do the same thing, only put it on low back and encourage baby to turn around that way. So we talked about clary sage in the beginning about avoiding that during pregnancy, but around 37, 38 weeks, full term, now that's when you can pull out your clary sage. Or when you're in labor and you've stalled and you need to help those contractions get, strengthened and get a little stronger, now clary sage is going to come to your rescue. So you're going to put clary sage on the inside of your ankle bone. So say this is your foot, the inside of that ankle bone, that's where you're going to massage that clary sage. Also the pinky toe and your low abdomen. And you can do that every, 15 to 20 minutes to help those contractions start again. That will definitely be helpful. Then now once baby comes, I'm trying to, again, talk fast and go through this to make sure we get everything in. Once baby comes, now you might have after pains, and those can be pretty intense. So oils that I recommend for after pains, let me see if I can give you my my blend for that. Hold on just a minute. After Pain Magic. So that is 10 drops of Clary Calm, 8 Siberian Fir, 8 Copaiba, and 5 Lavender. So this is what you would rub on the low abdomen right after birth. So let me just give you a little explanation of what's happening. So you have your uterus right here, and inside is the placenta, and it's attached to that uterus, okay? And now the baby comes out, and now that placenta comes out. Well, where that placenta was, there were little blood vessels right in here that fed that placenta. And so here's your uterus, and you need your uterus to contract really hard to act like a tourniquet on all these little blood vessels right here. makes sense? So you want that uterus to contract, but that contraction can be kind of painful. And so this is the blend again that I would recommend that you would use. And again, you're going to put that in a 10 ml roller bottle, filled to the top with fractionated coconut oil, and just rub that right over the tummy. Let me tell you a little secret. You'll find that when you get my whole protocol book, you'll find that Copaiba is in most of my blends, because a little secret about Copaiba is it helps all the other oils work even better. So just so you know, when you have something going on, I've had some neck strain for the last couple of days, and I've used my regular oils, my deep blue, and the regular oils that I would use on it, but I also use Copaiba. Also, it's great for pain, but it's going to help all the other oils work better. So just a little secret about Copaiba. So again, after pains, that's going to be a great blend to go to. Peri spray. So lots of stuff going on down there, lots of intensity that now has to heal. And so let me see, I've got another blend for you for that. So this is going to be 10 drops. Yeah, actually, you know what? I'm going to just make that easy for you. This is going to be Immortelle. Again, just take just half of it and fill the top with either fractionated coconut oil or witch hazel, either one. And you can use that as a spray, put a spray top on it, and use that for that perineum area to help it heal. You can also spray a pad and put that in the freezer. Now you have a cold pad to put on that area right after birth. So those are going to be little helps to to help you through that postpartum time. Breastfeeding. So I talked just a minute about peppermint decreasing your milk supply. Copaiba is going to increase that. Fennel will also, and basil will also. So in the very beginning, I said put basil around your breast, avoiding the nipple, because baby doesn't need breast milk to taste like pizza. So just put it all around, avoiding that area. And then do fennel internally, a drop or two. Now I add Copaiba to that, and because it just increases your milk supply just like magic. It's so awesome. So just, keep that in mind when you have a decrease. All you have to do is put a couple of drops of Copaiba under your tongue, or take our Copaiba soft gels, either way. I do have a blend that helps, a blend that helps increase your breast milk. And it's has a few, certainly a few oils in it, but it's fantastic for helping you increase your breast milk. So this might be a gift that you do, make up a roller bottle of this blend to give out to someone that is getting ready to have a baby and going to breastfeed. This would be an awesome gift. So 2 drops of geranium, 5 drops of clary sage, 5 Copaiba, 3 basil, 3 fennel, 2 lavender, and 2 Roman chamomile. Now the oils that are in this blend I created this to not only help increase breast milk, but oftentimes lack or decrease is related to stress. And so you can see that like lavender and Roman chamomile would help address those stress issues when you have a decrease. So again, same routine. Put this in a 10 ml roller bottle, fill to the top with fractionated coconut oil. You're going to apply this to around the breast, avoiding the nipple, And I would recommend doing this after you finish breastfeeding. So by the time you go to breastfeed again, it's all absorbed and you don't need to worry about washing anything off for babe. It's totally, totally fine. So again, that's the recommendation for just increasing your breast milk. If you just want to do a soft gel of copaiba or a couple of drops of copaiba underneath your tongue every day, that's totally fine too. Let's see, I do have a question. How many drops would you put in a bath? Again, that's just common sense. So, think about, a blend that you would use, maybe 2 or 3 drops of each oil. If you're using 10 oils, you might do 1 drop of each. If you're doing 3 oils, 2 or 3 oils, 3 or 4 drops of each oil is going to be good. Okay, newborns. So when my babies are very first born, how am I doing on time? When hey, I don't want to run out here. Give me a thumbs up. Okay.
Go for it.
All right. So newborns, frankincense on the crown and the spine. My babies get this from the time they're 2 hours old. I put a drop or use the frankincense touch down the spine and a little bit just on my finger and just massage into the top of their head on their crown. So that's going to help with, it assists the circulation and transfer of oxygen in the cells. And it also helps with bonding. So frankincense is just an amazing oil, and I love it for newborns. And then myrrh on the umbilical cord. So myrrh is like a liquid Band-Aid. It's going to seal everything off. Think about that umbilical cord. That is a direct line to every system in that baby's body. And so if it is left open and unprotected, even the tiniest germ can get in there and make a baby sick. And so you want to, our bodies are they know how to do it. God made us just perfect. And so usually when that cord is cut, there's a little blood clot that seals that right off. But myrrh helps support that even more. And so usually when I put myrrh on the umbilicus, and I am using, myrrh is so hard to get out. So I'm like shaking it, and, you don't even get a drop out, even no matter how hard you shake it. So I'm just getting a little bit out of my finger. I'm mushing my fingers together like this. And then I'm just massaging that umbilicus where it was cut, just right there for a minute. And I'm going to do that right after, when I, when I'm working on baby, doing all the checkup and that. So I'm going to do that probably about 2 hours after birth. And then I'm going to do it again on day 1 and again on day 3. And then I might have, if mom has myrrh, sometimes she has it, sometimes she doesn't. So it doesn't really, it's okay. I might have her do it just around the umbilicus at a week if she hasn't, if I'm not there at a week. So, and that's going to help that cord dry off and fall off so much quicker. So my cords will probably fall off 3 to 4 days, when sometimes they could take 2 weeks or even more. So again, myrrh on the umbilicus, it helps seal it so that no germs can get in there and helps that cord dry and fall off quicker. Balance, I'm going to use on the bottoms of baby's feet, because think about balance. It's very grounding and helps you be in this present moment. So this baby has been in the womb, all snuggled up, nice and warm and tight for 9 months. And now it comes out and it's cold and it's wet and it's bright lights. And now you're putting these clothes on me. And I'm probably pretty sure sometimes babies want to crawl back up there. And so balance helps keep that baby grounded. This is a safe place and keeps them here in the present moment and, help to better adapt to their new situation here. And then Melissa. I do a drop of Melissa on baby's feet just in the very beginning because, I could do a whole talk on Melissa. Melissa is like, so there's so many dimensions to Melissa. But it helps, just in a nutshell, it helps to repair DNA on an emotional level. So I just take that little bottle of Melissa and I just dump it like this. So I'm not even getting a drop. I call it a scant drop. And I'm just taking that on the bottoms of both babies' feet and just rubbing it in, and then take their feet and rub it together. So sometimes in pregnancy, babies are smart. They know what's going on the outside of the womb. And, you have a mom that has, 3 boys, and they just really want a little girl. And they go to that ultrasound, to that gender reveal, and it's another boy. And for a split second, they're like, oh. And then, of course, that goes all away, right away, instantly. And they're so now they're boys, they're on their way to their basketball team. But for that split second, there was that little emotional drop. And babies pick that up. And so Melissa can go in and repair any of that negative emotion that happened anytime throughout that birth. And the good news is it's never too late. So I would recommend everybody here put a drop of Melissa underneath your tongue. Rub it at the roof of your mouth. It is amazing, and it will do amazing things. In fact, my team has a challenge to do a drop of Melissa at the roof of their mouth or underneath their tongue every day for 30 days and report. And you would not believe the phenomenal experience that comes back. I challenge you to do that. It's pretty amazing. So let's continue on with well baby care. So now for mom, this is when having her own oils is going to be super, just a super benefit. So frankincense on the back of baby's back, on the spine, and I always recommend Frankincense Touch. It's already perfectly diluted. It's easy to use. It's all, everything is, I just love all of the touch oils. So Frankincense Touch, it helps to balance all the body systems, and it's that gentle but powerful immune booster. So Frankincense Touch on the back. Geranium on the feet to help support breaking up that bilirubin that, there's 60% of babies get a mild form of jaundice, and it often peaks on day 3. So geranium is going to help that liver help break up that bilirubin into tiny enough particles that now it can come out. So geranium is your key oil for that. On the bottoms of the feet, like at every diaper change, that's what I would do for, for the first week. And then skin support, Rose Touch is my favorite to recommend for any sort of baby skin support. For digestive issues for baby, first of all, mom, avoiding all dairy. That's my number one thing. Mom, avoid dairy. And then digestive touch, and now we have the new Tamer Touch, which is fantastic. So you have a baby that has tummy issues, just apply that Tamer or that digestive touch right around the belly. The belly button is the sweet spot. Even in us big people, if I have any digestive issues, I'm putting a drop of Digestin right in my belly button, and like instantly it's gone. For bottoms, baby bottoms, helichrysum is super healing and will heal any sort of issues with bottoms. And then for teething, Siberian fir or copaiba are fantastic for that. So postpartum blues, sometimes, there's moms have postpartum blues. That's just one of the downsides of our hormones trying to come back into order. So lavender helps, basil helps balance neurotransmitters, and lavender is going to stimulate serotonin release. So those are two great, great oils to use. Now we have the new adaptive blend that is my new favorite for that. Adaptive capsules and the adaptive roll-on, the touch, the oil you would use for the diffuser, the roll-on touch you would use for, on your pulse points, and the capsules I would use every day. Now for postpartum depression, I would say use 2 at night. If you have more anxiety, you would use 2 in the morning. So a little bit of it can help with both things. It's just a matter of what time of day you would use them. Keep in mind the most common deficiency with postpartum depression is your B vitamins, low in B vitamins, low in omega-3s, and magnesium. So you definitely want to make sure that you're taking your Lifelong Vitality. Lifelong Vitality is the perfect prenatal vitamin for all through pregnancy as well as breastfeeding. So I wouldn't combine it with another prenatal. I would only take that, and you're going to be covered with everything that you need. The emotional oils, are cheer, peace, forgive, console. Those would be oils that I would especially use for miscarriage. If you were to, had a friend that you wanted to gift something to during that hard time, any of those oils would be fantastic. So just to end, I want to give you just a everyday routine that I have that I recommend for my clients that has been super successful. So I always recommend 80 to 100 grams of protein every day. This can have such a major effect. I have never had anyone have preeclampsia. Not any of my clients have ever had preeclampsia. That protein is so important. So 80 to 100 grams of protein every day. And if I have someone that is, someone that messages me that, that's their issue, I say increase your protein to every 2 hours. And that can be, so it's hard to get 100 grams of protein in a day. So I recommend protein at every meal and then protein snacks in between. So you're getting protein like 5 times a day. If you are, if you have those symptoms creep up, then I'm wanting to make sure you're getting protein every 2 hours. So 80 to 100 grams of protein every day. Dark green leafy vegetables every day. So that's your natural folate. Lemon or any other citrus in all of your drinking water, which is 3 to 4 quarts a day. Some protective or immune blend on your feet every morning. So whether that's On Guard or Stronger or any one of those oils in On Guard, change it up. I always recommend to switch up your oils so that your body doesn't get used to it. And so I just always say switch up your oils. So some sort of protective or immune blend on your feet every day. 2 drops of frankincense underneath your tongue every morning just for well-being. Frankincense is our #1 oil for inflammation. Right behind it is copaiba. So those 2 are great to do every day. Again, a whole food prenatal vitamin. I recommend Lifelong Vitality. And I also recommend you take the full dose. Lots of people just take half dose, and I recommend the full dose because you need all of those vitamin and minerals in order to get what you need for pregnancy. There are some that might say, can I leave out like the CRS? Absolutely. The CRS is really targeted for pain and inflammation. Who doesn't have pain and inflammation in pregnancy? So I don't know why you would leave that out, but definitely the daily nutrition pack is cheaper and that doesn't have that in there. So by all means, you certainly can do that. And then a digestive enzyme. So we didn't talk a lot about the supplements, but digestive enzyme like Terrazyme, I recommend every single day with all of your meals. So depending on a little secret about that, when you take enzymes with your meals, now it's going to break up the food that you eat and help your body to utilize it and get to all the bits and parts that it needs to get to better. When you take enzymes on an empty stomach, now they can rebuild all your connective tissue and have a big impact on your connective tissue, which our whole bodies are made out of connective tissue. So I recommend 1 to 2 with 1 in the morning on an empty stomach, again at night on an empty stomach, and depending what you're eating. If you're eating a salad during the day, great, you can do 1 is enough. If you're eating meat and potatoes, a steak and baked potato and vegetables and that, then I'm going to definitely recommend you take 3 or 4 with that meal. So depends on what you eat, how many that you take. And then every night before you go to bed, make sure that you're using some sort of stress blend to help you de-stress. Okay, that was a lot of information. I hope that you were able to get everything down. Again, my book is going to be super helpful. All of that and more is in here. Look for my protocols book, because that will be, I'm trying to put all of my protocols in one place to help ease my load, so I'm not answering questions with everybody's protocol. But hopefully that will help you. Remember, you can find all this at essentialmidwife.com.
Stephanie, that was absolutely amazing. I'm speechless. It's brilliant. Thanks very much for your time. I tell you, we kind of alternate who's hosting the classes, and I kind of just feel there's this little friendly competition going on who can get the best. Now, unless anybody can get Queen Elizabeth using doTerra essential oils, I think we nailed it.
Thank you. You guys are awesome. I'm sorry, I'm looking at my time. I went over time. I could talk for 3 hours on this, really, and I talked so fast and still just only gave you a little bit. So
honestly, it was absolutely amazing. Appreciate you coming on. Absolutely fantastic. Thanks very much.
All right. Thank you so much for having me, guys. I have to run to another appointment, but y'all have a great day.
Oh, you said y'all. I was waiting for it. Thanks a lot. All right, cheers.
Right, bye now.
Bye. Okay, so how about that? Wasn't that absolutely fantastic? So what we do now, just if we can go over to Tina Parker, because Tina's going to cover her protocol that she